Hi, this is Bella Mehta. I'm from New York, but right now in Milan, reporting for Room Now. And one of the oral presentations today, looking at lupus mortality rates over the past few decades, was very interesting, and I thought I'd talk about it. This is data from the Spanish wrestler cohort, looking at around 3,600 patients, mainly Caucasian females with lupus. The abstract number is 0p 20 sorry oh, the abstract number is OP0229. This is where patients from the wrestler cohort are described. It's a pretty comprehensive list of variables that they collect, including disease activity, severity, medications, and socio-demographics. And they compared patients who died with those who survived at different time stages. So they looked at patients before 1980s, then in the 1990s, and then in the first decade of the 21st century. Um, and what they found was something that we know, that lupus mortality over time has decreased. So it was 18% before 1980s, which is pretty high. It dropped to around 6% in the 1990s, and then around 3% in the early 2000s. I think the key points to take away is that over time, mortality has decreased in these patients. However, what I found most interesting was that the reasons for mortality that they described have changed over time. So, vascular events, for example, were the leading cause of death in the 1980s for lupus patients. But in the past 2 decades, it's mainly been infections, which is the main cause of death. Now, is this because of more immunosuppressive medications or some other things is something that we need to infer from. But I think there's a significant shift. Also, the mortality predictors varied across the decades. So until the 1980s, hypocomplementemia and organ damage were the biggest predictors of mortality. In the 1990s, thrombocytopenia, antiphospholipid syndrome, and valve disease have been implicated for predictors of mortality. But in the last 2 decades or so, it's mainly serositis, organ damage, and a big one is depression. And again, these are things that are not talked about that much in lupus, but depression in lupus is directly linked to mortality here. Um, you know, some of the other things that they found was that skin involvement was associated with better survival in the recent decades. Um, Also, anti-malarial treatment overall was associated with improved survival in all of the decades that they analyzed. So I think in summary, it's a very comprehensive study that they presented, which shows the shift in the cause of death in lupus patients. This is a Spain study, but I think some of these things maybe can be projected even in other countries. And infection has been uh, the most important cause of death in lupus patients. Um, and depression, which I think is one of the big ones that they talk about, is directly linked to mortality, so needs to be addressed in our lupus patients. With that, I think there's a lot more interesting abstracts at EULAR that we'd report, and follow me more for more content on my Twitter handle, Bella_Mehta. And here's me signing off from Room Now. Bye. Thank you.